Can you all see my slideshow?
Yes, ma'am.
Okay, perfect. Perfect. Oh, are you seeing presenter view or are you seeing regular view? Presenter view?
Presenter view.
Okay. I don't know how to exit that. Let's see if I can do this again. I'm going to share the screen. Oh, what view are you seeing? Regular? Perfect. Okay. All right. Okay, so today we're going to switch a little bit and I'm going to present on supporting attachment through kinship and foster care. And so this is actually, and I'm super excited about this, but this is actually you know, a growing interest with a lot of judges and trying to understand more of the kinship and foster care, and a lot of information that I'm presenting in here is best practices and best quality care for kinship and foster care. And I went to a few conferences where, a lot of foster care and kinship care is child-centered, and a lot of different agencies are starting to focus that way. And we have a lot of great private agencies in West Virginia that are really trying to get this model and continue, but it's really difficult, right? Like so once I start talking about it, I'll explain a little bit more of how difficult it can be. So hopefully I give you some information on foster care and kinship care, best practices, identifying some of those challenges within that, kind of looking at it from a different scope, like a relational scope, exploring building a family, and some of the diversity, identifying diversity within foster care and kinship care, and the lack of some resources that we have in West Virginia. So I always start with attachment, right? We're talking about supporting attachment. When you think about attachment from the beginning, it's just linked to so many different pieces. And children, infants, babies, and children all respond based off of their interactions, right? These are thousands of experiences with caretakers and caregivers across the board, and it happens over time. So it's not just something that happens once or twice. It's those thousands of interactions that happen over time, and it's an unconscious reflex, right? And so we think of attachment and bonding, and bonding's a little bit different because it's intentional, where attachment is just kind of a reflex. It's just a response, and so it's all activated by the way that they're treated, right? So in the proximity of that, so think of that. Even for you, you probably have acquaintances that you can hug, acquaintances that you give a handshake to, acquaintances that you would never dream of hugging, right? And that's all based off those interactions. And so you develop that proximity and kind of that sense of it from attachment. And if you're a hugger, then you have that close attachment, right? And you were loving that hugging, or you might have missed it, right? And so you're teaching yourself to do that. You make a conscious effort. So just thinking of that as we move into some of these relationships, when we look at and we explore kinship care and foster care, we want to always remember that, when we talk about the risks of removal and, thinking about some of that, that's always secondary to a child's safety. We always want to put the child's safety first. And so when we talk about these pieces, we want to think of this as secondary. This is a child that's safe, not somebody that's really facing a safety issue, right? And we know that 99% of the cases, right, their primary goal is reunification. And so going into this, just knowing that that's the goal, is for reunification. And so we want to really start looking at co-parenting. That has to be built. So tons of the literature talks about supporting that co-parenting. And when we think of who co-parents, right, you co-parent foster and biological parents, and partnerships. So best experiences, right? Like, so we talk about, there was a movement in PA, and I can't remember off the top of my head right now, but there was a movement in PA where a lot of the research has identified that even if that child has one relationship with a biological family member, that they are 10 10 times more likely to be successful in their lives, right? And so just having that one biological relationship, doesn't have to be a biological parent, doesn't have to be, you know, an immediate family member, maybe a biological uncle or biological cousin, right? But it's so important as you start to build those relationships. And so along with co-parent, you're building some of those partnerships. Co-parenting is best, right? And it helps to build that best experience for family members. So one of the approaches, and again, we're looking at a child-centered approach to be the best approach. And when you think of child-centered, like what are the best needs for the child? And so the best needs for the child are to have a connection with their biological family. But many of the times they're in situations where they cannot. And so a lot of foster and kinship care have started to build and bridge some of those gaps. And that's what child-centered is. And so when I talk about building and building that bridge to fill that gap, one of the pieces that they're starting to do is when a child is not able to have contact with their parent, depending on their age, helping with journaling, videos, letters. And so foster parents are starting to, the one conference I went to, it was great. It was a foster parent and a biological parent. And the biological parent had substance use, and the baby was removed at birth. And what happened was the foster parent started journaling, like letters to mom. Like today, I opened my eyes and I looked back and forth, and I cooed 3 times today, right? Like whatever it was that was going on with the baby, it was almost like a narration of like a journal that this foster mom kept, and then she would send it to mom. And she made an effort without the child to go meet with mom twice a month. And so she was going and meeting with mom and talking to her about all of the updates of this child, right? Imagine that connection and the reduction in fear. Like I think of the parents that I work with that their children have been removed. And sometimes we work on just their visitation and focusing on how to build that relationship during their visitation because they get overwhelmed with, is my child getting taken care of? Are there bruises on them? Or, you know, are they being abused in their foster home? Well, imagine this foster mom taking that time to build that relationship, alleviating some of that stress, and then, you know, leaving that opportunity for that mom and that child to just build that natural attachment, right? Um, so bridging that gap is nice. Some videos too, as kids get older, they do like video documentaries. Again, if they're not allowed to see their child, they're not allowed to see the videos, but at least they have them from those dates and times that parents can go back and watch. And so that's a nice piece too. Um, so again, talking about the child-centered foster care, we want to focus on whose needs are being met. Looking at, you know, a lot of the times we look at extended respite foster care, and that's really not for the child, right? Like that's really what's best. If you think about sometimes we get caught up, and sometimes this is a larger picture, right? Operationally, we get caught up in things like schedules and having to push things back and court dates, and you know what I mean? That's the adult world. That's not based on what the child's needs are. And so we're missing that, and I think we're missing that focus on how to get that met, right? I don't know the answer to that because that is just a larger system that I think a lot of brains need to get together and figure out. But you know, we're not meeting those needs. But when we think of building attachment, right, we're going to go a little bit through development here, and we're going to look at what it looks like to build some of that. And having some of that knowledge and informed care helps us kind of meet some of those needs. Like we're talking about these foster and kinship cares, meeting some of those needs if they have some of that education, right? If we focus on attachment between just starting off young, 7 to 9 month olds, risk factors that we see with placement at 6 months and earlier are attachment to the foster parents, right? Already developed preferred provider. And so we know that within those early months that babies' gazes, their interactions with their providers, then they start to prefer a provider. And so we're disrupting that then at that point when we move them. Distress with biological parents and disruption in that relationship. So even from the beginning, right? A lot of times families will be like, they've been in the system since they were born. Like they never met their parents. So I don't understand why, like, there's so many behaviors around it. Well, there's still a change, right? That baby was still incubating in that belly for 9 months. And so there's a lot of attachment that occurs just right in utero and prenatally. So it's still a loss, and they might not be able to cognitively understand that, but there's still some distress around that, meaning that there's still different voices, right? Babies can hear and distinguish between two different voices outside of their mothers in the third trimester. And so if there's all different voices, all different rates and rhythms that are around them, that's distressful, right? We know if we walk into a room with somebody that's feeling a little bit different or out of place, like, we can feel some of that energy sometimes, and babies can too. So that can be a risk factor. So placement after 9 months, disruption in the already established relationships, rebuilding relationships, again, going through trust in those attachment figures, right? So that can be really distressful. I had a parent who was in treatment, and she was doing great in treatment. And she had she had a reoccurrence right at 8 months, delivered her baby and had it set up for her baby to go and stay, because she knew the baby was going to be removed because she had a recurrence, but had it set up so that her baby could go stay with her aunt. When the baby went to stay with her aunt never had children. Her aunt was very stressed. The baby was a little difficult to take care of. Her aunt got very stressed, and then they moved the baby from her aunt to her sister-in-law, who had 5 other kids. Her sister-in-law became overwhelmed with the baby, so then the baby went to foster care, and then back to her at 6 months, right? So she worked hard in getting the baby back. She worked hard in treatment. But even then, if you think about those first 6 months, right, that's a complete disruption, because now this baby has been through 4 homes. And so if we think about that 6 month risk factor, right, that baby had those gazes, had preferred provider, and then went all the way through it again, and now back with mom, right? And so that's a complete disruption within that first 6 months. Informed care and visitations. So we want to make sure that families know what's going on. A lot of the times when we talk to parents, and sometimes they're confused about their treatment, their MDTs, what's happening, right? We want to make sure that we're providing informed care, and even with older children too, right? They want to know what's going on. So we want to make sure they understand how often the visits are happening, when they're happening. This predictability is really important for attachment with kids and children. And again, if we think about this versus, child focus versus adult focus, and I know this is sometimes, beyond our control, but we need to start thinking about how we can better control some of this. How many times visits are canceled or rescheduled, or we can't find providers to go, right? I mean, that's a lack within our system. And some of those some of those situations are beyond our control, but we need to identify and start thinking about how we can control that a little bit more, because that's not child focused, that's adult focused, right? So they need that predictability, and how very important that is within these relationships. The nature of the parent-child relationship prior to placement. And so we want to understand what that relationship was like prior to. And then as we move children into those relationships again, where we see some of some of that disconnect, and helping support that along the way, and providing reflective practice with that as well. So just reflecting with the parent what that's like for them, right? We focus a lot with just children, and while this is child focused, we're looking at that relationship. That relationship is going to help the child the most. If there was neglect, some role reversal, right? A lot of the times we see some role reversal with parents. They want to, a lot of the times once kids are removed, parents have such guilt and shame, and they want a lot of the times to meet the needs of their children, and sometimes they feel like giving them what they need, like giving them what they want, right? And so then you see kind of a parentified child start to get formed, and that's the child that kind of takes control of the household. And so we want to make sure that there's not role reversal. We want to make sure that everyone's aware of what their role is, and we see that with parenting pieces. And I think families get a lot of parenting pieces, traumatic events, what that, those are influencing factors. We need to take that into consideration. What kind of traumatic events have occurred, how it triggers both, right, within that relationship. Um, and then the presence of kinship and foster attachments. Such a great, so I do PCIT too, parent-child interaction therapy. And I've had a couple families, but I have one family that keeps coming back. She fosters and she does an amazing job fostering. And she loves to come back right before a child's about to go back to the parent. And what she does is she'll come into treatment with the child, utilize these skills of parent-child interaction therapy to build that relationship with her and the child, right? And to manage their behaviors, but then to transfer that to the parent and then start including the parent and inviting them to treatment. Um, Naturally, CPS is always involved. She gets permission, but she thinks it's the best thing for the child, and it is, right? That's child centered. Like, this is the best thing. I remember the first child she brought, she was super sad because she really had such a close attachment. But when she saw how helpful that transition was, she brought her other foster kids back. And then she's like, I'm going to share your name with everybody. And I was like, I don't know if I have room for everybody, but I'll keep seeing you. Informed care and visitation best practices, parents' progression and treatment, right? Again, transparent treatment plans. We want treatment plans to be transparent. And I know sometimes, I've worked with and collaborated with whatever services are involved, and they're like, I told the parents over and over. These parents get so overwhelmed. There's so much anxiety, there's so much stress and so much fear that sometimes I'll go over like our plans. Like, I'm working with a mom now on some pieces of domestic violence that she wants to work within her case and present in court. And I go over our treatment plan every session because she forgets it every session. She works hard and she does a great job, but identifying those goals are really hard for her, right? Like, so sometimes she can describe more of what she's doing in treatment versus what her plan is and her goals. And so I think sometimes just remembering to support that. Finding those supports and exploring those supports for each family is really important. um well-designed weekly plans, like we talked about. Having that predictability for kids is really important. When things change over and over and over again, or when you have kids that are really looking forward to that, right? And so as kids get older, they're really looking forward to, it's like, here's a lollipop, and then they're like, nope, just kidding, like, you can't have that lollipop, right? That's what that can feel like sometimes. And again, I know some of the circumstances are beyond our control, but we have to start understanding also the impact that that's having on these children. And that impacts their attachment, and not necessarily even within their foster and kinship care, but with those biological parents. And then what it can do is create behaviors within the foster and kinship care homes. So we're kind of escalating some of those situations adversely. And so not even really thinking about that. But everyone's schedule is crazy. I look at my schedule book, and so I know that's hard, and I know we have to move things around, but I think if we can reduce that, that would be fabulous. As the treatment plans are completed, visits increasing this. So we hear this over and over again within our own patients, but best practice shows this too, right? Like, so all of the literature shows and supports that the best thing to do is that once people are completing pieces, right? Like you think of it as a reward system. How many of us, and when we think of reward systems, we always think of kids, but how many of us love being rewarded for some of the things we do successful, right? And when we do something super successful and nobody says anything about it, you're just like, oh man, okay, like, right? And so think of these people who are putting everything into something and just waiting for somebody to notice and not to have any reward with that, right? And so we want to make sure that we're increasing some of those visits as they start to complete some of this treatment plan. I think this is, one of the things that I notice in collaboration with this is sometimes there's still some concern with some of the goals that may have been met, and maybe looking at like, there's still a little bit of concern here. We need to be more transparent about that. Share that concern, right? We need people to be aware, like there's still a little bit of concern around this area. Let's work together to figure out how to ensure that we're comfortable with this and, you're comfortable with this. And so I think having some of those relationships and open discussions are really important. And we talked about when visits are increased, the consistency really is a key. Like we talk about even, I think one of the things that's hard, the one mom that I work with that I told you guys about that brings a lot of her foster kids, what we talk about is even visuals, like on a calendar, having like when they get to go see their parents, because they're asking over and over and over again. When you have kids whose lives have been disrupted and they're anxious, they ask over and over and over again. They need to know where they're going and when they're going and how long they're going, right? And now they've built attachments to the foster family, so they want to know when they're coming home too. So as they're a little skeptical maybe of some visitation, as they're building that, they want to know when they're coming home too. And so, in the best interest of the child, it's kind of opening that up and sharing on both ends. Um, where to support kinship and foster care, establishing that attachment, right? Helping kids to establish that attachment. A lot of the debate is that if they have, we talked about that first 6 months and then the 7 to 9 months, some of those risk factors. And the debate is, well, isn't it better to have that attachment initially? And it is, right? It is. And it's nice to have that attachment initially because it's easier to build that attachment with other relationships, right? Because like we talked about that first definition, it's all about those early interactions. But it still takes work and support. And so we still want to remember that it still takes work and support. And sometimes we as providers adversely interrupt that. And so we want to make sure that we're identifying that and helping maintain that attachment. Miscue of emotional and relational needs, right? I think I collaborate a lot about this because um, you know, some of the miscues that we see are, when you have, especially with substance use disorder, so when you have parents that have worked hard in recovery and changed their ways with substance use disorder, you have different parents. I just said this with two of my parents yesterday. I was like, where you were a year ago versus where you are now is a complete change. Like it's amazing. And two of the best parents that I know, right? Like amazing. But I think of the miscues, right? So if you have, and the one parent I work with, her little 7-year-old, right? And her 7-year-old has tons of anxiety and has some behaviors with mom. And if I didn't know this whole story, when the 7-year-old would come to me and say, I get anxiety around this, or mom doesn't like me because she says this, or mom does this, or mom, right? It's very different because mom is taking a very active role in her child's life now. And mom is setting limits. And so she gets very angry with mom when mom sets those limits, right? But it's necessary. Whereas before, when mom wasn't truly present, she was getting what she wanted easily, or she was getting away with more things, or, right? And so we see some of that, and then we see some behaviors escalate. And then I'll have other providers say to me, something's going on in the home, something must not be right. They might not be comfortable with their parents because they have all of these behaviors. Ooh, or is it miscues, right? Are they not used to this relationship and they have to rebuild? And so they're repairing that relationship with a different approach. And so we want to understand and we want to remember the relational needs, right? This relationship needs fostered. We don't want to feed into a child manipulating a situation because now they're not getting everything they want or not being paid attention to so that they can get everything they want, right? We want to make sure that we're understanding that. And trauma triggers. So we definitely want to make sure that we're understanding trauma triggers with children, what their responses are and what type of behaviors come from that. And so understanding trauma triggers and that they're going to be present, right? Again, we're repairing and rebuilding relationships. This has been completely disrupted. And based off of when they were removed in their developmental stage, we have to take that into consideration when we're looking at those trauma triggers and how to approach. So techniques to rebuild that attachment. Respond to physical, social, and emotional needs, right? Reflect two-way communication. So just kind of reflecting, repeating, paraphrasing, verbalizing actions and attention. Provide a routine. I talk to parents all the time. This is that predictability, right? In foster parents and kinship care. Remember, there's always going to be power struggles. We need to set those clear limits and boundaries because we want them to understand where those limits and boundaries are now, and they may be very different. Staying calm when a baby's upset, right? This could feed into trauma triggers. A lot of parents are triggered by screaming and yelling. And when you have disruption and stress within infants and toddlers, there's going to be crying and screaming and yelling. And these are stressful situations. We talk to parents about taking adult timeouts. We review safety, what that looks like. As long as the baby and the child are safe, take your own time out. Work on recovery. And when we talk about recovery, we talk about recovery as a whole. We want to remember that recovery is not only with substance use, but it can be with mental health. It could be within a family. So recovery is all around. So making sure that we're working on that. We talk about sensory nourishment, right? Rebuilding that attachment. And this is what I work with moms a lot on. I work with moms that have with postpartum. I work with moms postpartum, right? So they don't have postpartum, but postpartum after delivering a baby, on building that relationship, right? And during their visitation, taking that time and being present for their children. So present physically and emotionally. And we talk about that and what that takes, right? And sometimes, like I said, that's very hard to do when you're worried about what's going on or who's caring for your baby. And so we talk about ways to stay emotionally and physically available. Acknowledge and express emotions. This is that reflective piece. We want to make sure that we are acknowledging what emotions are happening and expressing those emotions, because sometimes, especially when you're a parent that's going back through and trying to go back, it's like the last thing they want is CPS involved, right? We talk about, no, you want to work with them, right? Like we want to work with them, expressing some challenges, expressing what's going on and how you're managing it, right? That shows your growth and development. And so we talk about that and feeling safe and comfortable in doing that. And so, a lot of the times, and I had one mom who was like, no way, I can't tell them anything. I was like, well, have you ever tried? Like, have you ever tried to tell them? And they're like, no. I was like, let's do it together. And we did. And they had a great relationship with their worker once they really opened up, right? But there was just such that fear we had to get past. Challenges for foster parents. So looking at the other end too, right? We know that there are challenges. The system can be a huge challenge for foster parents. Getting someone's needs met. We talked about access of care. So there are a lot of different pieces within the system. We talked about the system as a whole, right? It can be problematic. But I think we all come from different disciplines and we can all put our brains together and probably come up with a fantastic plan one day. That's my dream, right? Access to biological parents. Again, some of the foster parents that I work with that can't have access, right? Like they can't know, sometimes they can't know what's going on. They can't know the type of trauma that's happened to be aware of triggers. They can't access the biological parents to share some of this information with, like we talked about the journaling or the videos. Sometimes they're not allowed to, right? And so, but again, we're always putting safety first. So we want to make sure that that's priority, but sometimes accessing, sometimes biological parents are inconsistent. Sometimes they're not as involved, right? Sometimes they're not consistent. And so that's a huge challenge as well. Access to information, we talked about that. Consistent CPS workers. So we know that there's a high turnover rate with CPS. It's a very difficult job. And so we know there's a high turnover. And so sometimes the consistency within the workers. And I think this is hard with trust too, because we have very traumatized population that once they build that trust and they lose that worker, then it's really hard to build trust with another one, right? And then that's when they're calling everybody. Uncertainty of what's going to happen, right? The unknown of what's going to happen. And sometimes having planful transitions, that can be a challenge, right? Different transitions that kind of happen like the spur of the moment versus like one that's planned out. Those transitions are really helpful when they're planned out and kind of supported. But again, that takes a lot of collaboration. It takes a lot of time. And that's one thing that I think everybody struggles with is time, like just having the time to do this. But I think of how much we would be helping each child if we did make that time, right? And how much we could help unclog the system if we made some of that time. And it's like when I tell my parents, I'm like, it seems like a lot of time and effort that you're putting in up front, but it'll make a difference at the end. And that's where I feel like we will make a difference at the end if we put that time in it up front. So 29% of children in and out of home placements are cared for by relatives, which is fabulous. And we really want to promote and support kinship care. Like I said, there's tons of literature that supports like even having one biological or well-known family member. So the role transition, there's less of a role names. So these are the challenges, right? The loss of being a parent. And then what do they call them, right? So now you have sometimes a grandparent that's being called mom and dad. And so that can be a challenge. Um, Loyalty conflicts, we come across in kinship care families where sometimes the biological parents feel like that person's trying to steal their child or take their child or don't want them to have their child, right? We just had a group. I just had a group a couple weeks ago where the mother has worked really hard. She's finally getting her kids back this fall, and her cousin has, so kinship care, her cousin has the kids, and she's not been able to talk to the cousin. They've not been able, they just permitted communication with the cousin now. Her and the cousin are now talking. So she thought this whole time that the cousin was going to fight her for her kids. And then when she talked to the cousin was like, I'm so excited for you. I've been wanting this for you. And like, you could see mom, like, she was just so real. She was like, this was just so nice to hear all of the kind words, right? Someone acknowledging the work that, and she didn't have to fight for her kids from her. And so sometimes, there's even misconception around that loyalty to those relationships. We talk about generational ghosts, right? And so the just repeating patterns and seeing some of that and a challenge of that or seeing that that's going to happen. And so this can be both ways, right? So it can definitely impact a parent, if they've been through the system, right? So sometimes that pattern can repeat because they've seen those interaction that's the type of attachment they've built. And sometimes we can see that. And so sometimes that pops up, sometimes unresolved feelings. I worked with a grandma who adopted both of her kids, and her daughter was removed when she was younger, and the grandmother was a different person, right? And so she had some generational ghosts there. Like the daughter would bring up how she was, and the mom was like, I was not a good mom, or the grandma was like, I was not a good mom. But I learned my lesson, and I am a good grandparent. And well, we had to work on that, right? We had to work on her accepting she was a good grandparent because these generational ghosts had come up. And attachment of ambivalence, like that's going to come about. Like this is not an easy piece. Like a lot of people think like, okay, once we return the kids, like they should build their relationship and it should be fine. And that takes time. That repair takes a lot of time. And like I said, a lot of the times it's a lot of behaviors. There's a lot of structure that has to go into it, and therapy along with that. Best practices, family therapy with it, especially for families who've experienced substance use disorder, right? Individual therapy and then pulling together for family therapy. I have a mom who's coming to family therapy, and she's had her son back for over a year now, but the system just needs family therapy. They all did great hard individual work in the past year, and now they just need to pull together as a system. And like I'm super excited to do this because she's been so motivated and ready to get it all together that I'm like super excited to do family therapy with them. So that's really important. And sometimes when we have some of that ambivalence of attachment, sometimes we have parents that start to look at, if they need to let go, or if there's going to be reunification, and sometimes looking at that uncertainty and what that feels like, and just kind of reflecting some of those emotions. Um, Different feelings that can be around this, grief, loss, right? Shattered hopes and dreams. We had one mom that she did everything she needed to, but not at the very beginning. And it was beyond her control at the very beginning, but she did everything she needed to, and she still lost her children. Um, and her hopes and dreams were shattered. Like we're talking devastated. um and she worked hard. She continued to work hard because she built a relationship with the foster parent and now adoptive parent, and they said, if you continue and once this is over, you can visit your children, you can have a relationship with them, right? And so she worked towards that. She utilized that, but her dreams and hopes were shattered, and she didn't relapse in that process. So like I'm just like amazed. Like I can't even imagine being in that situation. So amazing. It's amazing. But these are some ambivalent feelings that can come about tough decisions, right? Talk about tough decisions in that situation. Totally vulnerable, right? You have no power and control over these situations, and totally vulnerable when you're thinking about that. Family building, focusing on the child's needs. Again, that's best practice, right? Positive support. Be trauma informed. Make sure you understand trauma. Make sure you're sharing education about trauma triggers, what that looks like, because that can destroy relationships within itself, right? Trauma responses, trauma triggers, and patterns of interaction can destroy relationships. If I've been traumatized because I don't know, say I got in a car accident, going down the highway. And now every time I get in the car, I get super anxious. And then maybe I get mean to my kids in that process, right? That's my trauma trigger. And now I'm taking my trauma out on my children. But from an outsider, it might just look like I'm being super mean every time I drive them somewhere. I must hate my kids, right? Like I must hate doing for them or taking them somewhere. That could be their interpretation, right? But for anybody who's trauma informed, you need to understand the situation and what could really be happening underneath. And if somebody were to help me understand that as I'm driving, it could help my relationship with my kids, right? And help them understand too that impact and what has happened. And then it would help support our relationship instead of discouraging it. And so think about, and that's just, that's a simple situation. Think of all the complex trauma some of our families have. Consistency, again, Kids need safety, security, predictability. They need to understand that things are going to happen consistently. So that consistency is really important. And that's why it's so important, when we talk about visitations and scheduling things, that's why that consistency is so important, right? In order to build that attachment and build relationships, we need consistency and self-care. So we need families to take care of themselves. We need not only parents to take care of themselves, we need couples to take care of themselves. And so we talk about that all the time. I'm a big proponent of self-care in parenting. And so we talk about how important that is almost every session and every visit. I talk about it with my foster families and kinship care, right? Everyone across the board, this is a stressful situation for. And so we talk about self-care and how important that is in every single dynamic. So. And just some resources. So these are the resources that I have pulled most of my information from. And they're really great resources. 0 to 3, I use a lot with families when we talk about understanding that developmental framework, kind of understanding where children are developmentally and what their needs might be. And then you can understand how some of this complex trauma has impacted them. 0 to 3 has great parent resources, but it also has this little piece of their site. I don't know, a little tab. It's a tab. This little tab where you can go and you can explore a child's brain, right? You can put inside like how old they are, and it'll tell you like what part of their brain's developing and what you can do to help promote that development and how to promote that relationship. And so it has great resources like that, but then it also has resources like screen time and what we do about screen time and what we do about behaviors and what some behaviors mean, right? If kids are biting, if kids are slapping. And so that helps us understand a little bit more too of what kids might be going through versus something must be going on. This, right? It is. There's some stress going on in the relationship. Let's figure out what that is and what they're trying to say. The National Child Traumatic Stress Network, that also has some great resources, great free trainings, trauma-informed care. So if you don't know about trauma-informed care, then this is great. This website also has handouts, but it also has some great free trainings, like a couple-hour trainings that can be really helpful. And then SAMHSA always has some great handouts, great connections, great resources, great educational pieces. And so these are like my go-to resources, as well as my colleagues. My colleagues always have some great go-to resources too. But these are the ones that I go to, and I think it can be really helpful when working with kids. Well, that concludes my presentation. Thank you all for
Well,
having me early.
no, thank you so much for being able to step in today. I greatly appreciate that. And that was a lot of good information.
Yeah, does anybody have any questions?
No questions, but just Amanda, thank you. Anytime I hear you talk, you just always remind me about patience, like just to be patient with the kiddos, to be patient with the primary moms, to be patient with the foster moms. I just am always reminded of that and how much I can gain from just slowing down with everybody involved. So thank you for that.
Yes, I'm so glad you said that, Katie. That makes me feel good that you're able to get that from this presentation, because when one of the most effective practices in working with moms who've experienced trauma and infant mental health is our reflective practice. Like to just slow down and reflect what everybody is feeling and take in everyone's perspective and how important that is, right? We all come from different lenses, and we need to make sure that we're looking at each person's perspective, because usually sometimes it's just some low-hanging fruit in there that we can just get to if we understand one another's perspective.
Yeah, well said.
I do have a question actually. Have you ever had to deal with an instance kind of like when you have the separation with parents and the child's with a foster parent, but like with like parents that are separated and then the child having like the trauma response, what's like for this example would be with the dad. Like, have you ever had to deal with something like that?
Yeah. Oh, yeah. Oh yeah, I think that can be, that's extra stressful. So when we talk about complex trauma, that's a little bit in complex stress, right? That a child might be dealing with. So not only are they separated from, and depending on if the parents were separated prior, right? Is this something that they've adapted to and then they were removed and now they're going back to adapting back to that, right? Or is this something where the parents were together through the stress of the removal, now the parents are separated? We've had that too. Um, and they may have stress, trauma based off of one of those parents' interactions. And so then what you have is you have discord between the parental unit, and then you have discord within the provider unit, and then you have discord within the parent-child relationship. And so, and that's why family therapy is always recommended, right? Because you have so many different systems going on. And so, absolutely different perspectives there, and you need to be patient with all those perspectives. But yeah, absolutely.
Thank you.
Welcome.
Thank you so much, Amanda, for jumping in. We really appreciate it. And this
You're
was
very
great.
You're very welcome.
Very
Thank you.
pertinent to the topic and the echo. I think the system is not always set up for best practices that you describe, but I think we can all, knowing them, we can advocate for them.
Absolutely.
All right, well, it's about the time. I hate to hold anyone up if they have other stuff going on today. So once again, thank you so much, Amanda. And thank you, Laura, for helping with all the behind the scenes. So our next session is going to be September 18th.
And we may the topic up since I think this was the topic for that session pretty much, Amanda, right?
Mm-hmm. Yeah.
Okay,
Yep.
so we will work to get people the topic for that in advance, and we'll be working on that in the next couple of weeks.
Yep. So all right, everyone, have a great rest of your day and rest of the week, actually.
See ya.
See ya.